embarked on strike action over delayed salary payments, raising concerns that the protests could undermine efforts to contain the country's Ebola outbreak, which health officials say continues to spread faster than response measures. The strike coincides with the start of enrolment for clinical trials evaluating treatments for the Bundibugyo strain of the Ebola virus, which is responsible for the current outbreak. Meanwhile, neighbouring Rwanda has reopened its main border crossings after several weeks of restrictions introduced to curb the cross-border spread of the virus. And for more on this, we are joined on the line by our correspondent in the DRC, Jimmy Shukrani Bakomera. Jimmy, good afternoon and thank you for joining us on Africa Update.
Good afternoon. Thank you, Lulu.
Now, what is the current situation on the ground in the DRC just regarding the Ebola outbreak? We're reporting that healthcare workers are on strike over delayed salaries.
Yes, the situation on the ground remains extremely fragile because the DRC is facing two major challenges at the same time. On one hand, the health authorities are trying to contain the Ebola outbreak, which continue to affect mainly provinces like Ituri and North Kivu, while maintaining surveillance in North and South Kivu due to high movement of people. On another hand, the Ebola response has been disrupted by strike involving healthcare workers who are asking payment of salary, arrear, and other benefit. The strike was particularly observed in several public health facilities in the affected provinces, where doctors, nurses, and laboratory technicians, even if the other frontline health workers, suspended routine service to protest months of unpaid salaries and delayed risk allowance. According to the representative of the striking workers, many staff members have continued working under dangerous conditions since the beginning of the outbreak without receiving the financial compensation they had been promised. And some hospitals operated with only emergency staff, while others significantly reduced consultations, laboratory services, and vaccination. So the strike come at a particularly sensitive moment because Ebola control depends heavily on the availability of trained health care workers. Every suspected patient must be identified quickly, isolated, tested, and monitored. When hospitals reduce their activities, patients may delay seeking just a treatment or avoid the health facilities, altogether increasing the risk of community transmission. That's on the ground, which is happening now, but especially in the Ituri province, because it's one of the area which recorded a high number of Ebola outbreak at the
Now,
first time in the
just
Democratic DRC.
very quickly, why have the salaries been delayed? What are the reasons that the health ministry is giving with regards to that? And are these, health workers, are they saying that they will not go back to work without getting paid, or are they negotiable to get confirmed dates or just dates where they will get paid?
The health workers' main grievance concern delayed salaries and unpaid risk allowance. They say that this is due to they dispute working and on the front line against the Ebola. Many doctors and nurses and laboratory technicians they said first of all the government did not respect the promise because the government don't care of those who are struggling against the Ebola outbreak. which studied the source of Bundibugyo in the DRC, and they say the government have a promise but no realization. And right now, the situation return on a grit, and they create just an unbelievable. For example, in Ituri, where there is an hospital, one health center which is working in the whole groupment. A groupment is something like a district, maybe somewhere, and one hospital, one health center which is working only. Uh, and when this is happening, when the number of affected of the Ebola outbreak is just on high. Reason why those health cares are saying, first of all, is the government which don't have this will of pay them, and which is not, maybe sometime, to don't respect the health workers affected in the zone in
Now,
Ituri and
Jimmy,
some more in
Rwanda has
Kivu.
reopened its main border crossings after weeks of restrictions. What does this mean for cross-border management and Ebola monitoring, especially in this now a crisis where health workers are not working?
Yes, the reopening of the Rwanda main border crossing with the DRC is highly significant because there's border post among births in Africa. Every day, every day before restriction, thousands of traders, student workers, and families crossed between Goma and Gisenyi, as well as official border post. So the reopening allows business to resume operations, transport service to recover, and families separated by the restriction to renewed. Local markets on both sides of the border are expected to gradually regain activities after suffering significant economic losses. However, this reopening does not mean that Ebola surveillance has stopped. On the contrary, health authorities in Rwanda and the DRC continue implementing strict public health measures just at officially entry point. Travelers continue, of course, to undergoing health screening, including temperature check and health questionnaires,
Yeah.
just here necessary.
Jimmy, we have run out of time and are going to leave it there for today. Thank you for joining us on Africa Update.
Thank you so much.
That's our correspondent in the DRC, Jimmy Shukrani Bakomera, joining us on the line. It is 12:30, and our news headlines up next.
SABC News.